The previous two speakers were rather focused on the central nervous system or nervous system itself. I'd like to focus on the bladder itself. Well, I'd like to introduce the hypersensitive bladder, which is taken after the concept of overactive bladder in the concept or in the structure. Well, what is? Okay, I have no COI here. And hypersensitive bladder, this is a kind of a conclusion slide. Hypersensitive bladder is a condition with hypersensitive bladder symptoms, which are comprised of pain, pressure, or discomfort in the bladder, usually with urinary frequency and nocturia. And the second condition is non-confusable diseases such as infection, malignancy, and so on. Okay, terms for ICOS conditions, there's many terms, like IC painful bladder syndrome, bladder pain syndrome, and so on. But, are they used in distinct meanings? In reality, these words are used interchangeably, and these ambiguous definitions or inaccurate usage of terminology cause confusion in practice and research. For example, as a patient with such symptoms when come in to your clinic, you may give a diagnosis for her or for him, PVC or /IC, as a symptom complex. And after excluding some diseases, you still use PVS/IC as a diagnosis. And even after you find the HANA lesion in the bladder, for example, you still use PVS/IC as a diagnosis. But we need each term for each category. Otherwise, we make some confusion in discussion or in research. And these words were used in pain and in its term, painful bladder pain, and so on. But does pain fully describe IC symptoms? This is a definition of ICS or PBS. It says suprapubic pain, suprapubic pain. What is pain? What is pain? Pain is defined as the International Association of the Study of Pain, like an unpleasant sensation and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So pain, in its broader sense, may include pressure or discomfort. This is a definition of PVS by Sufu and Yue. It says unpleasant sensation, and in parentheses, pain, pressure, discomfort. So pressure, discomfort, or pain, pressure, the discomfort are treated likewise as one unpleasant sensation in this definition. And BPS by 6 says chronic pelvic pain, pressure, or discomfort. So pain, pressure, and discomfort were treated as distinct symptoms. And the pain dictionary Longman, Oxford, says a feeling you have when part of your body hurts, or highly unpleasant physical sensation caused by illness or injury. So I'd like to say pain is a pain. Discomfort is discomfort. Pain is not discomfort. And pain is not the most common complaint seen in IC patients. Most common symptom would be frequency or a kind of urgency. And so we say we use some special terms to describe symptoms, like frequency, urgency, pain, discomfort, or avoiding difficulty. But these terms are specific, a kind of medical term. And these words cannot describe what the patient is saying. It is like incessant need to void due to discomfort, or loss of ordinary urinary sensation, or irritable sensation by just a little urine. So it suggests of the visceral hypersensitivity of the bladder. So the pain, pressure, and discomfort on this issue, experts presume that the pressure and discomfort are included in the pain by definition, But experts and patients understand that pressure discomfort is different from pain in reality. And pain is too restrictive to describe symptoms experienced by patients. So a new category that encompasses pain in the broader sense, but does not carry pain in the term, is necessary. And I'd like to remind you, overactive bladder, that is a very successful naming. It is well recognized as a disease or condition, despite it was defined as a syndrome. It sounds as a disease or condition by ending with bladder. Bladder is an organ name, so overactive bladder sounds as a disease or condition. And it is not explicitly referring to leakage. No, it's not like, for example, leaky bladder or urgency incontinent bladder. It says overactive bladder. It's a very important point. So I'd like to suggest hypersensitive bladder. Hypersensitive bladder is a condition with hypersensitive bladder symptoms and no confusable diseases. And the interstitial cystitis should be defined like that. The interstitial cystitis should have symptoms, hypersensitive symptoms, and also bladder or cystoscopic abnormality. That would be an example by the hand lesion or mucosal bleeding after distension. It is sometimes, said as the glomerations, but I'd like to use this time mucosal bleeding after distension. So in this case, we can use different words for each category. For just the symptoms, we can use hypersensitive symptoms. The patient has symptoms. And after excluding confusable disease, we can use the hypersensitive bladder for that patient. And after you find some abnormalities in cystoscopy, you can use, this patient has interstitial cystitis. As you know, the interstitial cystitis have such abnormalities on cystoscopy, hand lesions, and mucosal bleeding after distension. There's some argument that the mucosal bleeding after distension or glomerations are non-specific findings or a kind of a normal variant. I would rather against that because this is apparent, clearly different, clearly abnormal to my impression. It is just a spotty bleeding, maybe a kind of normal. But it's when you see that or whole bladder begin to bleed after distension, we can't say it is normal. So anyway, so in that case, according to the hypersensitive bladder, introduction, so we can use this is an algorithm of a patient with hypersensitive bladder symptoms. First you have to, differentiate confusable diseases, and you find no such diseases, you go to the hypersensitive bladder. And then you go to the cystoscopy or without tidal distension. And once you find the abnormality on cystoscopy, the diagnosis would be non-HANA type or HANA type IC. But you find nothing, so then non-IC hypersensitive bladder. And because symptomatically, the hypersensitive bladder, some overlap with the OAB. And the leakage or pain is highly discriminated between them. But the other symptoms like frequency nocturia, urgency, strong urge to avoid or discomfort, whatever, are overlapping. And pathophysiologically, as you know, the bladder is a very, very sensitive organ. And it has multiple systems to detect nociceptive stimulations. And so I take just one example of trip channels, because there are so many systems I can't say in this short time. So I just pick up the trip system. As you know, the trip family has an capacity to respond to chemical, physical, or thermal stimuli. And so it is distributed in the bladder and urothelium or in the interstitial tissue. And so we have examined the messenger RNA expressions of bladder tissue from the control. Control means the non-cancerous mucosal tissue of bladder cancer, superficial bladder cancer. and no HANA-type IC and HANA-type IC. And the sample number is 11, 17, and 22. And obviously, the symptoms is pretty much worse for IC patients. But this is expression of messenger RNA or bladder tissue. And from the left column, you can see the many TRP channels examined. And the left, the lower three is the A61 and NGF. A61, NGF. NGF is a nerve growth factor, and CXCL9 is an indicator of inflammation, and UPK represents the uroplaki. With this very complicated table, so in summary, the HANA-type IC shows the messenger RNA expression increase more than 3 times for three times fold increase for M2, TRP M2, and CXCL9, and more than 1 time fold increase A1, M8, V1, V2, and A61 NGF. And for no HANA-type IC, well, there's a huge increase of NGF. The HANA-type IC shows some pro-nociceptive inflammatory reactions. And the no HANA-type IC shows sensitization of afferent nerves. Anyway, I'd like to say IC is a kind of a disorder of hypersensitivity. So the pain is too restrictive to describe symptoms. And unpleasant sensation that is suggestive of visceral hypersensitivity. And not only pain, but also discomfort. And bladder is a very sophisticated sensory organ, and bladder pathology of IC suggests inflammation and hyperactivity of nociception. So, well, I come to the concluding slides again. Hypersensitive bladder is like that, and interstitial cystitis should be defined like that. And so, by doing these definitions, the advantage over hypersensitive bladder is it represents the symptoms more broadly, not only pain. So it means without oversight. And the suggests a regulated nociceptive sensation pathway, which causes unpleasant sensation. And it's akin to OAB in the structure and the context in the nomenclature. So the direct conclusion, IC is symptoms and cystoscopy abnormality. And hypersensitive bladder is symptoms, but it is not fit to IC definition. And these nomenclature or definitions would be sensible and more understandable from clinical and biological perspectives. Thank you for your attention.
Thank you, Professor Homma. So this presentation is open for discussion.
Jane Maylink, IPBF. I very much support Professor Homma's approach with the hypersensitive bladder, and many of the patient organizations around Europe who've looked at the term hypersensitive bladder are very enthusiastic, because this is a very patient-friendly, patient-centered approach. I suspect that in the past, many patients have been sent home without a diagnosis, or even the wrong diagnosis, maybe diagnosed as OAB, because when the doctor says to them, "Do you have pain?" they say no, because they don't consider discomfort or pressure to be pain. That's not what they've learned as pain. And so they go home, wrong diagnosis, wrong treatment, and they become very desperate. But hypersensitive bladder includes everyone in this category, and nobody will get excluded. So I strongly support this approach.
Thank you.
Yes, please.
You're behind me. I say he was first. Okay. Jerry Blavis from New York. I very much support that categorization. I wish we had a better name for the first part of it, that's all. But I have a question and a comment. Over the years, many people have shown pictures of glomerulations and Hunner's ulcers. And when I see them, they seem different. And the specific question, and I'll make my comment before you answer if I could. The specific question is that the ones that you just showed, it appeared that there were areas of normal bladder interspersed. If the entire bladder looked like that, would you still call that Hunner's ulcers or interstitial cystitis? And the comment is that I want to just remind everybody that this condition has a differential diagnosis. You mentioned the other diseases. And the 6-week time period that you put on it, I would personally like to see it be a little longer than that, but that's okay. But the important thing is I have seen about 10 very bad, mostly fatal bladder cancers that present like this. So the message is that when you see this the first time, in my judgment, you must do another cystoscopy at some point in time, and I think it should be within a month to 6 weeks to make sure that there's not an underlying bladder cancer.
Sure. Yeah, thank you.
Thank you for this interesting lecture, but unfortunately I disagree with you.
Yeah, that's okay.
This is because the symptoms you mentioned are more with the overactive bladder, we can say that. We cannot say hypersensitive bladder syndrome because this means that there is something that sensitized the bladder to cause these symptoms, while a lot of times the cause is neurological. Sometimes it is from the prostate, it is not from the bladder. So this category can be under the overactive bladder.
Yeah, well, it should be, well, it's not under. Well, it has, OAB and hypersensitive bladder share the same pathology under the symptoms. It is kind of a hyperactive or afferent pathway. So that's why we see these symptoms overlapping and may misdiagnose each other. Yes.
Yeah, but what I mean that the term hypersensitive means that I did something that that makes some more sensitivity in the thing.
Yeah.
But the term overactive bladder is like a generalized term. There is some.
I see.
Thank you.
I understand. Okay. Yeah.
Back on that one, because one of the typical features is pain or discomfort or irritation on filling of the bladder. So the hypersensitivity part comes from the urine entering the bladder. And maybe it's like that, but there's a very big difference between hypersensitivity and overactive bladder. I would have thought.
It's maybe a program in English, so maybe. Okay.
To follow up with the comments, some may argue that overactive bladder is not always the best term for this condition, overactive bladder syndrome, because it really focuses on the bladder, while the perception of the sensation perception or the sensation of urgency may be more of a central process. Now, so proposing that hypersensitive bladder is also a focus on bladder could generate some discussion. What's your take on that? By labeling it to the organ of the bladder, while we've been discussing more of a central sensitization. So what is your opinion about that?
So we have to consider at least two parts, the bladder and the brain, okay? But when you consider both at the same time, it's impossible. You have to divide it, the pathophysiology, into brain and bladder. And otherwise, we cannot get progress in research or clinical research or basic researches. And so, I'd like to focus on the bladder rather than the brain or nervous system, entire nervous system, just bladder. We should watch the bladder first, and then we need some the other aspects of a pain, like a nervous system or brain. After that, as I am a urologist, so I should concentrate first on the blood itself. So we need a cystoscopy to diagnose to make a correct diagnosis for those patients.
Great. Well, thank you very much. I'd like to thank the panelists, the presenters, and the audience for being here.